Welcome to our education session on percutaneous axial pumps, specifically the LV Impella device. As PICU nurses, you'll encounter these devices in critically ill pediatric patients with severe heart failure or cardiogenic shock. By the end of this session, you'll understand the device mechanics, your nursing responsibilities, and critical complications to monitor. This knowledge is essential for providing safe, competent care to some of our sickest cardiac patients. Think of the Impella as a tiny propeller inside the heart. It's inserted through a catheter and positioned across the aortic valve. The impeller continuously spins, pulling blood from the left ventricle and pushing it into the aorta. This isn't just moving blood, it's actively supporting the heart's pumping function while reducing the workload on the damaged heart muscle. How does it work? Physiology continuously unloads the LV, reduces cardiac workload and oxygen consumption, provides higher cardiac output with lower cardiac work, preload dependent and afterload sensitive, more tolerant of arrhythmias than IABP. The beauty of this device is that it works differently from other support devices like balloon pumps. While a balloon pump requires the heart to beat in a specific rhythm, the Impella provides continuous support regardless of heart rhythm. It's like having a backup pump that takes over some of the heart's work, giving the damaged heart muscle time to recover. Placement is done in the cardiac cath lab, or OR, by interventional cardiologists. The device must be positioned precisely. Too far in and it can damage the mitral valve, too far out and it won't work effectively. You'll see continuous monitoring of placement signals on the pump console, and any changes in these waveforms could indicate device malposition. These contraindications are absolute, meaning the device simply cannot be used safely. If you hear about any of these conditions in your patient's history, the Impella is not an option. Severe aortic stenosis prevents the catheter from crossing the valve, while LV thrombus could be dislodged by the device, causing stroke. The purge system is absolutely critical. Think of it as a protective barrier that keeps blood from getting into the motor and causing it to clot off. You'll monitor purge pressures continuously. If these drop, blood can enter the system and the device will fail. This is one of your most important monitoring responsibilities. Programming and settings. Program level P level determines impeller RPMs. Higher P levels equal sign greater hemodynamic support. Flow is proportional to RPMs. Settings adjusted based on patient needs and tolerance. The pump has different performance levels, kind of like gears on a car. Higher P levels provide more support but also increase the risk of hemolysis, breaking down red blood cells. The team will adjust these settings based on how much support the patient needs and how well they're tolerating the device. Your monitoring tools. 2 pressure waveforms used as placement signals. Aortic pressure optically transduced at outflow positions. Inlet pressure calculated using motor current and aortic pressures. Motor current proportional to pump torque. These waveforms are your eyes and ears for device function. Normal waveforms tell you the device is properly positioned and working well. Changes in these patterns can indicate malposition, obstruction, or other problems. You'll learn to recognize normal patterns and when to call for help. Nursing assessment and interventions. Hemodynamic monitoring, continuous vital signs, cardiac output trends. Insertion site care, assess for bleeding, hematoma, infection. Neurological checks, monitor for signs of stroke or embolic events. Renal function, watch for decreased urine output. Laboratory monitoring, CBC, coagulation studies, chemistry panels. Your nursing assessment is comprehensive because this device affects multiple body systems. You're watching for bleeding at the insertion site, changes in mental status that could indicate stroke, and kidney function changes. The device requires anticoagulation, so bleeding risk is always a concern. Document everything meticulously. Small changes can indicate big problems. Critical complications to monitor. Bleeding, 33% incidence, most frequent complication at insertion site. Hemolysis may occur due to malposition or high motor speeds. Limb ischemia, obstruction of femoral artery can occur. Suction events, inadequate LV filling can cause device malposition. Cardiac arrest, changes to P2 recommended initially. Bleeding is your most common complication. 1 in 3 patients will have some bleeding issues. Watch insertion sites like a hawk. Hemolysis shows up as dark-colored urine or rising LDH levels. Limb ischemia means the leg isn't getting enough blood flow. Check pulses and color frequently. Suction events happen when the heart is too empty and the device starts pulling on heart tissue. Patient and family teaching. Movement restrictions, limited mobility to prevent device displacement. Signs to report, chest pain, shortness of breath, dizziness, bleeding. Expected sensations, may feel device vibration. This is normal. Duration expectations, temporary support while heart recovers. Family presence, encourage involvement in care when appropriate. Families are scared when they see this device. Explain that the vibration they might feel is normal. It's the pump working. Emphasize that this is temporary support to help the heart heal. Teach them what to watch for and when to call for help. Their child needs to stay relatively still, which can be challenging, especially with younger patients. Documentation and communication. Device settings, P-level, purge pressures, flow rates. Placement signals, waveform characteristics and changes. Patient response, hemodynamics, symptoms, tolerance. Complications, any bleeding, changes in status. Interdisciplinary communication, clear, timely reporting to team. Documentation is crucial with these devices. Record device settings every shift and with any changes. Note the quality of placement signals. Are they crisp and clear or dampened? Communicate changes immediately to the medical team. This isn't a device where you wait to see if things improve. Early intervention prevents disasters. When to call for help, red flags. Sudden changes in placement signals. Significant bleeding at insertion site. New neurological symptoms. Decreased urine output. Pump alarms or error messages. Patient reports new chest pain or shortness of breath. These are your call, don't delay situations. Don't try to troubleshoot pump problems on your own. Get the perfusionist or physician immediately. New neurological symptoms could indicate stroke. Any significant bleeding needs immediate attention. Trust your instincts. If something doesn't look right, get help. Summary and key takeaways. Impella provides continuous cardiac support for critically ill patients. Nursing care focuses on hemodynamic monitoring and complication prevention. Device positioning and purge pressures are critical safety parameters. Early recognition and intervention prevent serious complications. Interdisciplinary communication is essential for optimal outcomes. Caring for patients with Impella devices requires vigilance and expertise. You're managing a life-saving technology while providing compassionate care to scared families. Remember that this device is temporary support. Our goal is helping hearts recover. Your careful monitoring and quick response to changes make the difference between good and poor outcomes. These 3 references provide comprehensive coverage of Pediatric-Specific Nursing Considerations, Borelli et al., 2024. Covers the unique aspects of caring for children with Impella devices, including sizing considerations, complications monitoring, and family education specific to the PICU setting. Contemporary Acute Mechanical Circulatory Support Nursing, Kapoor and Papalos, 2022, provides current, evidence-based nursing management strategies for all major mechanical support devices, including detailed Impella care protocols and complication management. Foundational Impella Nursing Care and Program Development, McCulloch, 2011, offers practical insights into establishing nursing competencies, training programs, and standardized care protocols from an experienced clinical perspective.